All right, got 3 stories from real patients that came in telling me what they were told either by social media, a physician, or what their previous physical therapist told them or did with them. So you tell me which is which. Scenario number 1, patient has plantar fasciitis, was told to roll on a ice bottle, stretch their calf constantly, buy inserts for their shoes, and never walk barefoot. Scenario number 2, patient with low back pain. Advice was don't ever bend over at your low back, keep a neutral spine at all times. Use ice and heat alternating for 10 minutes apiece. Take medication and don't ever lift anything. Last scenario, 13-year-old athlete, soccer player, anterior knee pain that kind of comes and goes. Front of his knee is point tender and he's got a little bump there. So he was given a straight leg brace and told to be locked at 0, 24 hours a day, 7 days a week for 6 weeks. Told to ice when he did take the brace off, but not allowed to bend his knee. Don't bend your knee ever. And then when you do take the brace off, your knee has to stay straight and you can ice it, but that's it. You can weight bear on it, but you have to have the straight leg brace on at all times for a 13-year-old athlete with mild Osgood-Schlatters. So you tell me which genius gave him that advice. So as you can see, most patients get terrible advice from social media, physicians, physical therapists. I didn't throw chiropractors in there, but you can definitely throw those guys in there, and massage therapists, and athletic trainers, and personal trainers, and their mom and their dad and their cousin and their next door neighbor and whoever else. So there is terrible information all over the place. Unfortunately, the majority of that information comes from medical professionals who are supposed to be experts in giving sound advice, which you would think, would be based on science versus symptom modification, avoidance, scare tactics, buying garbage, repeat visits, all that crap. So if you want to get out of the mess that social media, physicians, physical therapists, chiropractors, aunts and uncles give, you need to get back to science, you need to use critical thinking, and you need to do that by getting in the shift.